ॐ नमामि धन्वन्तरिम् आदिदेवम् सुरासुरे वन्दित पादपद्मम् लोके जरारुकभयमृत्युनाशम् दादारमीशं विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जनाः सुखिनो भवन्तु सर्वे सन्तु निरामयाः। ॐ शान्ति शान्ति शान्तिः।
Om Dhanvantari Nama. Thank you, Dr. Preeti Madam. Good evening to all. It is my utmost pleasure to welcome you all to this section where we have the privilege of hosting a distinguished speaker, my esteemed Guru, Dr. Anand sir, a renowned Ayurvedic physician and an expert in Rasa medicines. Throughout this section, Dr. Anand sir will share his vast knowledge and experience on the topic clinical Rasashastra for managing respiratory disorders. I request each and every one of you to actively participate and ask thought-provoking questions as we collectively explore the complexities of Rasa medicines. Before we begin, I would like to take a moment to express our heartfelt gratitude to Dr. Anand sir for taking the time to share his expertise with us. He's going through a tight schedule as he has been selected for framing the PG syllabus. His presence is a testament to his dedication to the Ayurvedic community, and we are truly fortunate to have him with us today. Without further ado, it is my pleasure to introduce our esteemed speaker, Dr. Anand sir, who had completed his graduation and post-graduation from Government Ayurveda College, Trivandrum, Kerala. He had taken fellowship from Institute of Ayurveda and Integrative Medicine, Bangalore. Kerala Bhasha Institute has published book under the authorship of Dr. Anand sir on metals and their medicinal significance. He had designed Ayur Mask, an organic environment-friendly herbal mask during COVID-19 outbreak. He was invited as a speaker of European Ayurveda Congress at Koblenz, Germany. He had conducted webinar series in the name of Rasadarshanam in online Apta webinar series for spreading awareness of Rasa Chikitsa among practitioners. He is serving as Secretary of Ayurveda Medical Association Research Foundation. He had presented scientific papers in various national and international conferences, conducted various radio talks and awareness programs in visual media. Presently, Sir is working as Associate Professor in the Department of Rasashastra and Vaisheshya Kalpana in Government Ayurveda College, Trivandrum, Kerala. So, without further delay, let us start this informative section. Over to you, sir.
Thank you, Dr. Anjita Kabir, my student, for introducing me. And a very warm good evening to everybody present here to listen. And we have a discussion after the presentation. So let me thank the organizers who are getting the pain. You are taking the pain to conduct all these webinars for the progress of our science. I must acknowledge them. The organizers of Sri Babu Singh Jai Singh Ayurveda Medical College, Farrukhabad, UP, and the respected HOD, Dr. Benani Das, Professor and HOD of Rasasastra and Vaishyakalpana, and Dr. Prabal Dikshit, Associate Professor, and all the distinguished guests there present here, and dear doctors and my dear students. Let me share my screen to open the presentation. Just 1 minute. Now you can see the screen, isn't it?
Yes, sir. Yes, sir.
Okay. So, okay, is it okay now?
Yes, sir.
Yeah, fine. We can move to our presentation. So, I may start with a lot of medicines are here to use in respiratory diseases. You can see starting from the Shwasananda Guliga, Shwasa Kudhar Rasam, Kavaketu, Kombajadi Guliga, Gorojanadi Guliga, Gobi Chandanadi, Surya Prabha, Chukkum Dipalyadi, Lakshmi Vilasras, Ananda Bhairavaras, Shankhavadi, Punarna Mandura, Asturia, and the list goes on. And you can even create a Sahasra Yoga with the medicines which are told in Kasa and Shwasa. But the thing is that if we are able to use it according to the specific conditions, if we are able to use it very specifically, we will get good results. So we have to differentiate each. We have to look into the patient, the Vyadhyavastha, through the signs and symptoms uh, which he exhibits. So by through that we should enter into him and what is his problem, and from that we have to select the medicines accordingly. So how whatever the medicines are with us, a lot of medicines are there, and even modern medicine is nothing. We have a lot of choices, but we need to apply it in appropriate way. Otherwise, we would not get any result. So coming to that, we have to look into the yogi. Which medicine is to be selected in which condition? That makes you successful. So let us think about that. So a lot of anupanas are also available in different kashayas are there. Aristas, Kanagasavam, Bringarajasavam, Pipalyasavam, Dashamula Arishtam, Jiragaristam, Lakshas Ringyasavam, Manduryaadyasavam, Pardharishtam, Lohasavam, Abhayaristam. Lot of anupanas are also there. But my point is that you have to select the apt one. If you have 100 choice, you will be confused. From selecting the right one from that makes you successful. So the CASA, when a patient comes to your clinic, you should look at some of the things in him. First, we go through that. From that, we get an idea how to select the best out of this list. So you can consider the causes of CASA. It may be due to dhumopagada, the reja, that is from external factors, including many of the allergic manifestations. Then vyayama, adivyayama, overexertion. Then ruksha anna sevana, and it is due to the aharas which we are taking. Vimargatva abhibhojana. So obstruction, vimarga gaman. So some of our food item may not enter our respiratory, may not enter our food tract. It enters into respiratory tract. Simply because of that, it may cause kasa. And vega varodha. Many of us are in habits. Our vegas are controlled, and that may cause, that is also one of the reason for basic reason for this uh, pathology. So the basic pathology underlying the kasa, cough, many types of cough are there, but the basic underlying factor which we need to address is nothing but prana. In that prana is dushta, prana pradushta, and udana anugada. So the prana vayu, you have to target the balance of the prana vayu as well as udana vayu. That makes you successful in treating the cough. So when you look, there are a lot of coughs. Panchakasas are told in our Shastra. So how can we apply this Panchakasa? And all the cough are not same. So some medicines are specific for Vadika Kasa, some are best for Vada Pitta Kasa, some are good for Kabha Kasa, and again Kabha can be Kasa can be classified as Tanu Kasa, Tanu Kabha, like that. Different classification. So which medicine fits into the category? That makes a very important determining point of your successful practice. So if you look into a Vada Kasa, a Rogi having a Vada Kasa, what is his predominant feature? Shula is there, where the pain is there, Hridaya, in the chest area, the pain will be there. Then Udara, Parsha Shula, the sides, the ribs, beyond the ribs, maybe like a costochondritis. There may be the pain there with on the chest area. Vada Kasa, the pain, the manifestation of pain is there. Then sadam is having tiredness. The patient will have tiredness. And the kshina, the bela is kshina, his swara is kshina, the sound is affected, and the ojas is also declined. So by this appearance, we can capture that it is a vatika kasa. So we should do the treatment according to that. Not all medicines are fine for him. For Vadika Kasa, let us see what are the medicines working in the coming slide. Before going to that, we can look at the Pitta Kasa, in which you can see there is a jora, a rise in temperature in Pitta Kasa, in Paitika Kasa, a slight rise in temperature is there. If you Darshana Pariksha, when paridahya mane sharire, burning sensation will be accompanied sometimes. And also, Trisharda, he is having thirst, much thirst. Vamed Pidani, the expulsion. The sputum will be yellowish in nature. And Kanduni. So all these are features of Paitiga Kasa. You can see Pitta Vriddhi in that. And it is the doshic predominance you have to account. Then you can select appropriate medicine. That is very important. Then Kabha Kasa also. Kabha Purna Deha, Sharira Gaurava. Heaviness is a cardinal feature. Kandu Yukta. His throat may be itching. You can ask the throat is itching, ear itching is there, like that. You can ask. And then uh, Mukha Pralebam. There is a coating, our coating is there. In the tongue and the mouth, you can see that. Shiro Rujarta, heaviness and headache may be accompanied as a comorbidity. Kased Birsham, Sandra Kaba Kabhan, it is full of sputum. It is productive. It is a productive cough. We can see that. And Kshada Kasa is another important variety in which you can see Urakshada is a main reason. A person coming with one of my patient came after hitting a hemothorax or pneumothorax that may lead to pneumonia and he can be in complication. So what we need to do? I have given him Bhagna Chikilsa as well as Kshada Kasa Chikilsa, Urakshada Chikilsa. So we can discuss about what we can do in those cases. So, sa purvam kasade shushkam, and mostly dry cough is there. So there are palpitation, and you can see suji bhiriva tudyamane na shulina, pricking pain in those cases having urakshada or akshada kasa, you can see there is a pricking pain in the that area, the chest area, and there is a chest congestion. You can see a chest congestion there, and you can even palpate it. You can auscultate it. Parava idi kujanam. The auscultation, by auscultation, you can elicit the problem, the urakshada there. And the complication, you can see that the parva bheda, jwara, shwasa, trishna, it can lead to even pneumonia. This urakshada can lead. So we can prevent that. We can prevent by introducing the specific medicine to him. In the coming slides, we will be discussing that. And Kshaya Kasa, the last variety, is due to Vishama Bhojanam. Vishama Bhojanam or Asadmya Bhojanam. And due to some malnutrition can also happen, or due to Rajakshma like things. The Rasadhadu, Srodho, Dushti may be there. Anyway, the Deepana, Pachana, and Srodho, Shodhana should we have to do that to bring about changes in this spectrum of disease, the patients having this type of problem. So, Vega Nigraham, Adi Maidunam, overindulgence in sexual activity, all these can cause Chayakasa. And these Samprapti, we can see the Agni Mandhyam is there, and some of them having Tridosha Kobam. The Chayakasa is having Tridosha Kobam, and Agni Mandya is there. And you can see that Nishtivati Rudhiram Sapuyam. So blood sputum, you can see that the blood in sputum and pus in sputum, and like a TB patient, in TB patient you can witness all these things. Shushyandi, Prakshina Mamsa, so the emaciation is there, Gatra Shulam is there, Jwaram is there, and Daha, Moha, and Pranakshaya, even it can end up in death. So it's like a tuberculosis patient, presenting complaints are like that. So we can even apply a patient Kshaya Kasa Chikilsa to a TB patient. Okay, then coming to the remedies, you can see we have already discussed about the features of Vadika Kasam, in which we can see that the Vadika Kasam, the dry cough is there. And you can see a lot of patients coming to your clinic may have dry cough without any sputa. The best choice there, the Rasausadhi there is Abraga Basma. So even though lot of Rasausadhis are useful, Abraga seems to be very useful in my experience. Why? Because it is Vada Pitta Kshayagnam. So in that condition of having Vadika Kasa, Abraga Basma 50 milligram, if you give to the patient, the condition will definitely be improved. And also along with that, if you accompany Anupana like Vidaryadi Kashaya, is very useful. Vidaryadi Kashaya is very excellent in Vada Pittotara where there is no phlegm, there is no productive cough, only dry cough. In that, this is very suitable to the patient, and you can have definite result by this. And also you can use Akshatva Punapaga, which is which will definitely cure the condition, and Bhangi Gulam is one among the choice. Even with Abraga Basma, 50 milligram of Abraga Basma, and accompanying with the Vidaryadi Kashaya is very excellent. And even with these two medicine, we can have very good result in this Vadika Kasa. Now coming to Paitika Kasa, you can see that you can use even Shanga Basma. Shanga Basma is very much specific in Amla Pitta. So you can see in Paitika Kasa, many of the features are similar to that, and even Pitta Vriddhi is there, and even the biles may be also accompanying, bile secretions are more. So you can use Shanga Basma. And even in many of the regurgitative disorders, some of times the patient may have some regurgitative problem. In those cases also we can adopt this Shanga Bhasma is the best medicine there, and you can have a cure for that patient by using this Shanga Bhasma, which is very excellent in Amla Pitta. So that medicine can be applied in this Paitika Kasa along with a Sahapana of Amrita Dashamula Kwada, which is told in Sahasra Yoga, and even Siddhopaladi Churna you can use along with. So Kabbaja Kasa, when coming to Kabbaja Kasa, one of the remedies which you can apply is Godandi Bhasma. Godandi Bhasma in a dose of 200 milligram you can use along with honey. And Bharnyadi Kashaya is very useful, which can accompany this Godandi Bhasma. Bharnyadi Kashaya, Adipravartam Shwasam. Even Adipravarta Shwasa can also be controlled by Bharnyadi Kashaya. And the Talisa Patradi Churna is much more effective in Kabbaja Kasa. So now coming to Vada Paitika Kasa, Vada Pitta Kasa. You can see the Abraga Bhasma and Vidoyati Kashaya, which we have discussed in Vadika Kasa. The same remedy will also work in this. So now coming to the Kabha Vadika Kasa, you can use Godandi Bhasma. Along with that, Dashamula Kadatraya Kashaya can be used as a Sahapana or Anupana, and Tarisa Patradi Churna and Nayopayan Kashaya you can use. So Kabha Paitika Kasa you can use Shangabhasma, Ela Kanadi Kashaya and Siddhopaladi Churna as remedy. So now coming to the Shwasam, before that we have already discussed about Shayaja Kasa and Shadaja Kasa. In the coming slide, it will be there. Otherwise, we will discuss in those areas. Now, coming to Shwasa, Kasa Vridhya Bhaved Shwasa. So, turning of Kasa to Shwasa. So, if it is not properly addressed, if the Kasa is not properly addressed, it will turn to Shwasa. And you can see Amadisara, Vamadhu, Visha, Pandu, Jara, Adisara, all can be accompanied. This exposure to Reja, Dhuma, Anila, all these external factors can precipitate this. And the drinking of Adi Himambu, cold stuff, refrigerated stuffs are always taken by us. It can also lead to Shwasa. And the Marmabhigada is another thing which can precipitate the Shwasa. And anyway, of all these causes, there is an obstruction of Vayu. Obstruction of Vayu due to Kabha Vriddhi. So here the Prana, Udaga, Annavaha, Srodho, Dushti. You can see Prana, Udaga and Annavaha, Srodho, Dushti. And it is actually Ama Shayod Bhavam. This Shwasa is Ama Shayod Bhavam. And the Sthana Samsraya is at Uras. So this is basically an idea regarding the Shwasa in short. And you can see another variety of Shwasa, which is very different from this. Many of the patients, the pathology may be different from the respiratory. So you can see Pandu Shwasam. Pandu Shwasam, you can see patients and when the Rekta Dhadu will be very less in them. Even the HB count, if you check the HB count, the blood count will be very less. In those patients, they develop Shwasa. So you have to trace what is the reason behind the Shwasa and treat accordingly. And if it is due to a Pandu, the Shwasa is due to Pandu, the best remedy is the Abraga Bhasma or Pravala Bhasma or any of the drugs which we use in respiratory disorders. But the best one is to increase the Rakta Dhatu, that is Kasi Savasma. So in those patients, even if they are having Shwasa, you need not, within 5 minutes, the inflammation will be relieved. Within 5 minutes, you can see Even if when you apply the Tangana with honey over the tonsils there, you can see that the patient get irritated first for 2 or 3 minutes. But after that, all the phlegm will be expelled out so that all these rhodosis will be cleared and it will so much relief to the patient. So that is the importance of local application. And if you can't do the throat pain in a patient, you can have a gargle. Gargle with a Spadiga Basma. With Panikurka is a herb in Kerala, but you can use Tulasi Sarasa instead of that. And the Spadiga Basma, you can add to a warm water and you can have a gargle. And you can also add Tangana Basma to the warm water, lukewarm water, and you can have a gargle with that. You can advise the patient to have a gargle. And very specifically, Kandakari. Kandakari is very specific. When whatever be the Rasausadhi you use, this Kandakari Kwada is very much important and it is very specific to the respiratory system. And you can do simple lehanas, simple licking, some home remedies like that. You can advise very simple one, very cost effective, like Ardraga Swarasa, Vasha Swarasa, and you can use Vasha Pudabaga Swarasa. If you are not able to do Vasha Pudabaga, you can do it in a home very simply. Put some this Vasha leaves in a warm water, very hot water. You will get and then press it and make it juice. You can get it juice without Pudabaga. You can get, and it will be very lighter than the original Swarasa, and you can use it along with Jiraga. You can use it. So these things you can adopt in your clinic very simply. So now coming to the Kasa Chikitsa, in Vadika Kasa, we have already told about the Rasausadhis, which we are the best. We will get the result with the Bragabasma, and along with that, you can see the Vadakna Siddha Snigdhaischa Peya Yusha Rasadibi. So you can use some food stuff. You can advise some food stuff along with that medicine. So it will have a very excellent result in the patient. You can have a diet chart including Snigdha Yusha. So you can 3 or 4 drops of even Grida you can use as Yusha. In Yusha, along with the Yusha, you can use 2 or 3 drops so that the Vadiga Kasa can be addressed. Then soup, the Mamsarasa can also be used along with the Vidarya, the Grida. 2 or 3 drops only along with the Mamsarasa soup. And the Mudga Yusha you can use along with the Vidarya, the Grida. These are all very good after the application of the Rasaushadi, Ablaga Bhasma, and the Vidarya, the Kasha. You can even modulate the patient, help the patient with this type of diet. Then Lehanam, you can use Lehanam with the Bhargi Gulam, Kambula Rasayanam, the Shamula Rasayanam. And the dose is very important for this. And in our Samhidas, it is Muhur Muhur. So Alpa Alpam Muhur Muhur is the best dosage form which we can apply in this condition. Now coming to the Swedanam, Kaba Swedam with Nagavalli Patram, Ushma Swedam with Tulasi Patram. All these are very important. Swedanam. This rhodosis has to be opened. For that, Swedanam is very essential. Along with this Shamana Chikitsa, with these Rasausadhis, you can do Swedanam. That is very good for this type of patients. Some Lehana yogas are there, like Duralabha, Sringaveram, Shadi, Drakha, Shidopala, Karkadaga Sringi. These you can powder it well and make it as a powder in your clinic. And you can apply it along with honey. You can advise the patient to take in order to make this rhodos clean. Then Pippali, Shundi, Bhargi, Ashwagandha, Purana, Guda, and Taila can be made as a Lehana yoga. The patient can lick that These are very useful, and these are not manufactured by any companies, but you can prepare your own. So, Paya prepared with decoction of Dashamula Panchamola added with Guda is good. And drink can also be suggested like Lishya Payaschanu Pibed Ajam Kasa Adi Pididam. So the drinks are also, we can uh, advise them some drink also. So these are very good for soothing the tract, for soothing of the tract due to Vadika Kasa. So coming to the Pitta Kasa, Vamana is indicated, but we shall not adopt it frequently. If it is required, Prabhuda dosha is the only this type of Shodhana Chikitsa is necessary. Otherwise, we can do Shamana Chikitsa itself. And there is a simple Vamana Yoga in this Madana, Maduga, Vidari, Churna, and it should be grinded in Ikshurasa. And if you give it, uh, a bout of phlegm will be out, not a very large Vamana, but a simple Vamana. Bout of cough will be expelled, like an expectorant. So there is a Lehana Yoga in which you can use it in Paitika Kasa, in which Mridviga 50 gram, Pippali 30 gram, and the Sharkara 50 gram you can use. And it is very good for Paitika Kasa as a Lehana Yoga. Simple one. And the Draksha, Amalaki, Kharjura, Pippali, Marija, all these can also used. So coming to Kabha Kasam, you can see there is a important variation from the other treatment. Some Hilas you can use instead of Gruda. And the Devadaru, Vyosha and the Yavakshara, if you make it like a Deepika Taila, drops of that Taila is very good for treating Kabhaja Kasa. So in Kabhaja Kasa, you can see the hypertrophy. The hypertrophy is there, chest congestion is there, then even the nasal turbinates will be inflamed. So you need a Tishna Dravya to cure. So Devadaru, the Devadaru plant, that bark, you can seal it with Vyosha and Evakshar, and you make it a fire like a, you can fire it, and through that you can produce this Deepika Taila. And this Deepika Taila used in 2 or 3 drops is enough. It's very potent. And the caution in dose and content is very important in Deepika Taila. Even you can use some of the Deepika Taila which is told in this Visha Chikitsa. That's also very excellent Deepika Tailas are there. And in this Kabhaja Kasa you can use, and in those patients you can see the hypertrophy. So if the hypertrophy is there, if it is having a Kabhaja, you make sure that it is Kabhaja Kasa, then you can apply this Deepika Taila. But if you apply it in a Paitika Kasa, you will get a reverse effect. The patient will aggravate, the condition will aggravate. So you have to be very careful in selecting the medicine according to doshic predominance. So Lehanam, the powder of Marija, Asida, Surasa, and honey good for Kabajakasa. Laja, Sidobala, Shringi, Datri, and honey is good. Rashamula Kwadam with Pipali Churna is very good. These are good Lehana for Kabajakasa. Then Vada Sleshmodagasa, you can use Dhuma, Dhumapana. That's very important, Dhumapana. And I must say, one of my experience while in Trivandrum government has the college itself, one of the patient was admitted in the ward, and while I am taking the casualty duty, the patient was referred from the unit doctor to general hospital for modern medical care. Why? Because uh, he has been uh, in continuous cough for 2 days, and they have applied all the drugs in Kasta Chikitsa as well as Swasta Chikitsa to the patient, and the patient doesn't get any relief. So I thought that I shall try one remedy for him. And just I have called my PG and told him to to give a Dhumapana with Manashila Divarti that I call. So uh, as soon as I give the Dhumapana to that patient, he is he is continuously cough for 2 or 3 days continuously, and going to the modern medical care. But after introducing this, I have uh, advised the patient to sit comfortably and the Dhumapana with the Manashila, the yoga administered. Within 5 minutes, I can see that the patient cough is no more. So I'm not telling it as a magic, but it happened. That was my observation. Why this happened? Why this happened? That I have thought, and I can see that by introducing the Dhumapana in this Kabhavadika case, maybe due to the Srodha the Srodha may have removed, and the Prana Vayu gets in its normal way. We can see that the patient may have some congestion, the patient may have some spasm. Probably his respiratory muscles and the sphincters as well as the diaphragm may be spastic. That's why he's in continuous cough. So if we are able to release the spasm, the patient will become normal. That's the thing. So as soon as I introduced uh, it's very interesting. As soon as I introduced the Dhumapana to the patient with the the Dhumapana, within 5 minutes, the Kasa got controlled and he doesn't have Kasa no more. So maybe by releasing the spasm, even I guess the vagus nerve may be stimulated, and it may have a result on to reduce the spasm of the diaphragm. Maybe it happened. Anyway, the result is that the patient got relief within 5 minutes. So the PG on that duty, they astonished by saying this. So the thing is that we have to trace what is the problem in that. Even giving all the medicine of Kasa, which is told in the text, he didn't get any relief. But by simple administration of a Dhumabana, he got relief, even without any internal medicine. So according to the cause, we have to handle the patient. So selection in Dudoshaja, you can follow these guidelines. If there is a Kabhanubandha Vadakasa, you have to treat the Kabahara Kriya. You have to take the Kabahara Kriya. So if there is a Pittanubandha Vadakabakasa, you have to aim at Pitta Nashana. And if there is Vada Sleshmatmage, so Snigdha Prayoga is needed. In Slushka Kasa, Snigdha Prayoga is needed. But in Ardra Kasa, which is Vada Sleshmatmage, Ruksha Prayoga is needed. So in Pittanubandha Kabakasa, Pikta Rasa Pradhana Dravyas are needed for Shamana of the condition. So you have to choose the medicine according to the different condition, and you select it appropriate. If your selection is appropriate, then you will get instantaneous result. So coming to the Kshadakasa, which we are going to discuss. So, the patient which I have told in the previous slide, which I have discussed, actually a tempo traveler hit his ribs, the chest area, and while taking the X-ray, it is found that the rib fracture is there. But he came to me, and I have given a Vibandha, Bandha. And then again, along with the Murugan, I have made that bandha with properly bandaged. And internal medicine, I have addressed not only the bhagna there, but due to the uh, hit of that vehicle, there is a urakshada there. So we have to address the urakshada. So very interesting that if you are able to address the urakshada, the patient will be very safe and no complication will come to you. What are the complications he may arise due to urakshada? Maybe he may end up in pneumothorax, hemothorax or pneumothorax, which will be complicated further. So if we are able to arrest that, we could manage the patient. No need of modern medicine. So by thinking this, I have selected a kashaya. How I have selected kashaya? What is that? In that I have selected Nayopaya kashaya. Nayopayam, Bela, Jiraga, Nagara. Only three drugs are Bela, Jiraga and Nagara. And it is very useful in chest congestion. Nayopaya is very good in chest congestion. And along with that, I have added Laksha. Why? Because it can also attend the fracture. This Kwada, I advise the patient to prepare Nayopayam. Along with that, I have modulated that Nayopaya Kashaya according to the patient's need. That is actually Vaidya. So, according to our logic, we can modulate. So, I have introduced Laksha. Why I have introduced Laksha? Laksha is highly Sandhaniya. Sandhaniya. So, for Urakshada, or if you are treating a Kshadakasa, you have to use Laksha. You have to add Laksha. That's a very important thing. So that due to this Sandhana, the property of Sandhana, the tissues, it actually covers the tissues. It binds the tissues. It stitches the tissues so that all the structures will be intact. So that is important. And you can also use Laksharasa. And, you can use Siddha Magardaja in these cases of Urakshada. It is a very good tonic, excellent tonic in the world, Siddha Magardaja. So the patient will be tired, the patient will be of Abhigada. Due to Abhigada, the prana dushti will be there. For all this, Siddha Magardaja is best. And is the best tonic, revitalizer. So you can revitalize the patient with this. So this is the way which I have attempted the case. And it was very successful and no complication. He doesn't have a cough. He doesn't have pneumonia. He doesn't end up in pneumonia. And within 21 days, the fracture has healed. So there is a experience with that case. So Urakshada, you can also use combination of Pravala and Damagardaja. So Pravala, you can use in two forms, either Pravala Bhasma or Pravala Pishti. So how you differentiate a Pravala Bhasma and a Pravala Pishti? So Pravala Bhasma, when you look into the preparation of Pravala Bhasma, you can see it is Agni Puda. So Agni Puda. So the samskara is in Agni, and so that it is helpful in Shwasa. It is very good in Shwasa and respiratory disorders. But the Pravala Pishti, you can see the process is different. According to the samskara, it can have some difference in its effect. So the Pravala Pishti, you can see it is a Chandra Puda. It is not an Agni Puda. It is Chandra Puda. It is Shidala. So how it will be useful in respiratory disorder? It will be useful in respiratory disorder having a patient having problem with the GIT. A patient is not theoretical, it is real. So he presents with a multiple of disease. So you have to take care of the comorbidity. If a patient is having amla pitta and the kasa, you can use best not pravala basma but pravala pishti. In this case, you have to use pravala pishti. Why? Because it is by virtue of its samskara, it is Shida. It by virtue of its samskara, it is Chandrapuda, and the Bhavana made it Shidala. So by that you can select it for a patient with Amla Pitta. And many of the condition you can this regurgitation due to the valvular problem. The some of the in many of the cases in some of the cases while presenting as cough, you can see that GERD one of such cases, GERD cases. Like that, some of the patient there there is a problem with the valves and the biles and the digestive secretions comes up into the respiratory upper respiratory tract, and it will have a written cough. They will have a written cough. So if you give medicines for like the Shamula Kadtaraya and the Tishna, Ushna, Ushadas, you will not get any result. But if you correct that for regurgitation, if you use Pravala Pishti, Kamadugarasa, like that, and even use Gulucha the Kashai along with that, it's you will get the result. So Gulucha is in no way connected to the respiratory system, but for that patient, it will work. So you have to see the patient, not the text. The patient is a reality, but the textual knowledge is a fiction. You have to convert that into the real situation. You have to adopt it to the real situation. So that's an example which I could tell you. So you can also see a laksha, sharkara, godhuma boiled in milk in urakshada. That's very good as a anupana along with the pravala and siddham magardaja. And you can see pravala is having a very good impact in the respiratory system because you can see the raw pravala is like lung itself, lung itself. In our CME, you have put a slide showing the lungs and the bronchioles. All those appears very much similar to pravala. And it is seen that the pravala basma can correct the structural deformity of the lungs. In many of the cases, I have seen that, I have observed that the structural abnormalities of the lungs can be corrected by Pravala Basma. And some combination we need according to the comorbidity, taking into account the comorbidity of the patient. So Kushmanda Rasayana is also very useful in this condition of Urakshada. And you can see a lot of that. We can treat very well these Urakshada cases. And Kshayakasa, in Kshayakasa, you can see that Agni Dibana and Brahmana should be given, and Srodho Shodhana is also very important. So you can see that how in Kshayakasa, the important drugs which we can use in Kshayakasa, it is a problem with the Srodhas have to be cleared, Agni Mandya have to be cleared, the emaciation should be cleared. A combination of Abraga Basma and Siddha Magardaja is very good. A combination of Abraga Basma, you can take 100 milligram of Abraga Basma and add 50 milligram of Siddha Magardaja. That is a very good combination working in Kshaya Kasa. So it need a lot of time to cure, but it will be improving. You can see many of the improvements to the patient. So prayogas common to Kasa, Chara prayogas are there, Mayura Picha Pasma. So Mayura Picha Bhasma, the ashes of peacock, which is very plenty in North India, I think. So in which respect the Mayura Picha Bhasma is useful? Actually, it is the indication of Mayura Picha Bhasma is not only Kasa, you can see that Hikka is there. So for irritant cough you can use. For Hikka you can use. For those patient having problem, Kasa due to problems with the spasm of diaphragm you can use very well, specifically the Mayura Picha Bhasma. And many of the times, some of the patients have regurgitation. You can also use Mayura Picha Bhasma. Kasaharam Param, one of the Lehana, which is in one of the texts of experienced Vaidyas in Kerala, the Lehanam, Kasaharam Param, Padmaga, Tribhala, Vyosha, Vidanga, Devadara, Vela, Rasna, and to this equal quantity of sugar, honey, and ghee. This lehana, the patient muhur, if they are taking this, it is uh, very useful in treating the case of kasa. Sarveshu Shwasa Kaseshu Mukhadharanam Vibhidaga Pudapagam Nakshatva Dharana. Vibhidaga, this have to be converted to Pudapaga. By virtue of Pudapaga, you have to make a Pudapaga of Vibhidaga fruit. And you can make a dharana in your mouth. And you can see, due to our saliva will be mixing with this Vibhidaga Pudapaga, and all those inflammation in those areas will be addressing. So that is very useful, especially in dry cough. It is very good. And you can use Lehana Guliga prepared with Padhya, Shundi, Musta, and Guda. Rasausadhis can be used, varies, lot of Rasausadhis. Amardarnavarasa, Bigunjam, Vada, Kasarthe. So the mineral content in is Kajali, Loha, Bhasma, Tangana, and Varsana is a very good combination. Pitta Kasandagarasa. The minerals here are Tamra, Abraga, and Kanda. So Tamra, it is Leghana too. So if you need Leghana, and I think in some of the cases I have seen that previously one patient visited and he has gone to a lot of clinics, including many of the important hospitals in Kerala, but didn't get any cure. And now he is getting cure with our medicine. And actually, his continuous cough was due to when he was examined and investigated, some nodules was there in his thyroid. Due to the nodules, maybe because of that reason, he has cough due to the irritation. So the formulations like this, which contain this Tamra Bhasma, Kanda Bhasma, all these are Leghana. And it can even reduce that irritation and it will be very useful. So in one of the cases where there is a cyst developing in the thyroid, I have given Rasagandhi Medical to that patient. And that cyst become shrunken and his cough relieved. So it may be due to different cause. So according to the cause, we have to select the Rasausadhi. So there are lot other choices. Kasa, Amahara, Bhairavarasa, Vadajam, Paitigam, Kasam, Slaishmikam, Shirajam Tada, chronic cough also. Vela Varna Kara, Kandi Vardhana. So the minerals are here Kajali, Abraga, Tamra, Loha, Tangana, and Shanga. So it is put to Bhavana in 10 Drava Dravyas. So it's a very excellent medicine. Kasa Amahara Bhairava Rasa. So Lakshmi Vilasa Rasa, every practitioners are using. Sarva Kasa Nivartaye. So it must be useful in all the types of Kasa. And you can see a lot of rasayanas in this. So that even the patient comes us after lot of therapies, we could help the patient. By the time, the bela of the patient will be decreasing. So if you give a treatment, it will not work. For that, you have to increase the bela of the patient. It is not the drug which cures the condition. It is the Sharira bala which treat the disease, which fights the disease. So we have to increase the bala. For that, these Lakshmi Vilasa Rasa are also very useful. It contains a lot of rasayanas. And many of the patients coming after lot of treatment to me, I give them Siddha Magardaja. When I give Siddha Magardaja, my observation is that all other treatment works very well because the patient get enough bala to process our treatment. To undergo our treatment, they will get bala by virtue of this rasayana. So Shwasa, for Shwasa, you can see Swede Rubajare, Taba, you can give Nagavalli Patra, Taba Sweda, Ushma Sweda is very excellent with the leaves of Tulasi, Panikurka, Nagavalli, etc. Then Ukkariga, you can use Sweda of Ukkariga, like Vasha Patra, Nagavalli, Potlis. For Aswedya, Swedana with warm milk and with the short period, you can use. Virejanam, you can do Mridu Virejanam. So in Tamagashwasa especially, you can do a Mridu Virejana, even with Avipatti. And if you give treatment after that, it will be very better. And Dhubana, you can use even in Tamagashwasa, in bronchial asthma also. Dhubana Yoga with the Haridra, Erandamula, Laksha, Devadaru, Jadamanji, Aridala, Jadamamsi, Aridala, Manashila. All these you can make into fine powder. You can grind it well, even with the Trigadu Kashaya, and you can roll into Dhuba. For Dhuma Pana, you can use sticks like that. But verify that your rogi is a Kabhavadiga rogi. For Paitiga rogi, you should not give this Dhumapana. Shamana Chikitsa. In Samavastha, Sama Chikitsa should be given Deepana and Pajana. You should indent Deepana and Pajana. So you can use different formulations. Anyonya Bheshajani. You can use drugs which are told in different contexts like Kasa, Shwasa, Kshaya, Chardi, Hidma. In a random way, you can select from all these areas to attend and to address the respiratory diseases. So in COVID cases, I have very good result with a combination of Pravala Basma, Abdraga Basma and the Siddha Magardaja. So this is a very good combination which I got maximum result in almost all COVID cases who is having respiratory complaint. The combination is a Pravala Basma 50 milligram, Ubraga Basma, Pravala Basma 100 milligram, Abraga Basma 50 milligram, and the Siddha Magardaja 50 milligram. And this combination works well in a COVID patient. In COVID patient, the bela of the patient will be less. So it will also be acting in the immunology of the patient as well as to strengthen the respiratory system. These are rasayanas. So there's, but for acute management of a respiratory case, I have done, a patient was in ICU and by next day, he could be transferred from ICU to general ward. by using Jayamangala Rasa. Jayamangala Rasa is very potent, and the Manashila and all those are very essential for the speedy recovery. And Malla Sindura and Kanda Basma, this combination works very well in acute condition. Jayamangal Rasa, 65 milligram, only half breath is needed. Then Malla Sindura 50 milligram, and the Kanda Basma 100 milligram. Kanda is a very important property. Kanda is that's very potential to increase the oxygen capacity. Kanda will increase the oxygen carrying capacity, and you can see when your pulse oximeter it is reduced, the measurement is reduced. If you introduce Kanda Basma along with Abdraga Basma and Siddha Magardoja, it will increase spontaneously. So it can act very quickly by increasing the oxygenation in your body. So for Virejana, you can have some combination Kashav, Draksha and Trivrt. For Nasya, sometimes you need to do Nasya for Srodho Shodhana, and Yeshti Madhu with honey can be used, and even Tegaraja Taila can also be used. Adhikhosham Ugram Swasam, high distress, in high distress, powder of Karkadaga Sringi, Shundi, Pippali, Musta, Pushkaramula, Shadhi, Marija and Siddha is a good combination to use, even in very high degree of that uh, respiratory distress. In Kashaya of Guduji, Vasha, Brihat Panchamula is favorable in some of the times. Shwasa and Pranaharanabi. Haridra the Lehanam. There is a Lehanam, and the indication is Shwasa and Pranaharanabi. So there is a very interesting definition, description, which describes it. Even in Pranahara condition, you can use this Lehana. Haridra, Marija, Draksha, Kana, Shadi, Rasna, and Guda. And Mayura Pichadi Lehana, which we have already discussed, and a lot of Rasausadhis you can see. Pipalyadi Loham, Shwasa Kudhar Rasam, Swarna Muktadi Guliga, Surya Prabha Guliga, Kabhakedu Rasa, Pravala Panjamrita Rasa, Shwasanandam. We can fortify Shwasanandam. We can discuss about that. Kanda Basmam, Kasisa Basmam, Abdraga Basmam, Pravala Basmam, Shanga Basmam, Karpura Shilajit Basmam. We have discussed it in its specific role. So in acute respiratory distress, why a patient is coming to you and gasping for air before you, what will you do? And we can't say that it is Amashyodbhavam and wait. We can't say like that. You have to address it. And how you address that? You can have a good remedy to deal with that. And you can use a Duma Pana, a Varti containing Aridala, or you can create a Duma Pana with Shwasaguda Rasa. You can make a Duma Pana with the Shwasaguda Rasa. And the indication of Shwasaguda Rasa is Kasa Shwasascha Mandaknau Vada Sleshmame Shuja Sannibade Murchayam Abasmare Tadapuna Adimohatwamabanne Nasyam Dadyad Vijakshana Rasa Shwasagudharo Ayam Sarva Shwasa Vigaranut. So this is very, very excellent in acute respiratory distress. And if you can convert even to a Dhumapana, it's again very good. So it's very good. And you can even differentiate a Shwasa Kuda Rasa with a Shwasananda Guliga. In Shwasananda Guliga, you can see that Hingula is the major conduct. So it will reduce the inflammation. But in Shwasaguda Rasa, you can see Manashila. So it is highly Srodoshodhana. So even if it reduces inflammation, it also pierces the Srodhas. That makes it a very good emergency medicine. Then you can use Surya Prabha Gulika in different conditions. How Surya Prabha will be useful? In many of the COVID cases, I have used the Surya Prabha Gulika along with the Amrita Arishta in the first stage itself. Why? Kasa Shwasahari Mahajurahari Namnatu Surya Prabha. Kasa Shwasahari Mahajurahari Namnatu Surya Prabha. So it can be given in a condition where there is inflammation. In all those inflammation should be addressed first. And a patient with a fever also accompanied with a chest infection. What is your choice? Your choice is not a Shwasanandam or a Shwasa Kudara, but you will go for Surya Prabhaguliya. Why? Is Shwasa Kartahari Mahajurahari Namnatu Surya Prabha. So a patient having fever as well as chest infection, you should go for Surya Prabhaguliya rather than Shwasanandam or Shwasa Kudara. That is the specific selection of the Rasa drug. So this type of expertise makes you as a best practitioner by using these Rasausadhis. So Samira Pannaga Rasa is another important, very excellent uh, formulation which will be useful in critical conditions. Samira Pannaga Rasa as well as that Malla Sindhura. That we'll discuss in another coming slide. So, Pravala Basma, we already discussed about its condition, and you can classify the kasam in different areas, and you can select specific remedies according to that. For dry cough, you can do a Tangana gargle with the Tangana Basma and Ani, or a throat pain with the Tangana Basma and Ani. Then tonsillitis, laryngitis, pharyngitis. In all those, you can use Spadiga Basma along with Tulasi Swarasa as gargle or throat paint. Cough with fever, you can use Surya Prabha Guliga in Nagavalli Swarasa or Kabaguda Rasa and Ardraga Swarasa. And for productive cough, you can use Kava Kedu Rasa, Pardha Arishta, and Kanagasava and the Shwasananda Guliga. In productive cough, this is very useful. So you can select the Rasausadhis according to its specific use. So these are some of the yogas, and we are coming to the end of our session. Coming to the last slides. Samira Pannaga Rasa, you can see the formulation. So these Kubi Pakwa Rasayanas, they are having a very good role in treating many of the respiratory pathologies. You can see Rasasinduram, Siddhamagaradajam, Samira Pannagarasam, then Malla Sinduram also along with this list. And why these are important is because these can enter into deeper dhadus. So if the Surya Prabha Gulika is working in your Rasa Dhadu and it correctly Rasavaha Srodhas, these rasayanas of Kubi Pakwa origin can go to your deeper dhadus. That they are rasayanas. Rasadina mayam rasayana. So they can travel to deeper dhadus. Rasa, rekta, mamsa, medo, asti, majja, and chukla. And they can enter to your brain tissues also and they make the changes there. Many of the commands come from the brain, and your brain have to be intact in your disease. And these Kubi Pakwa Rasayanas are very important, those instances. Malasindura, Siddha Magaradaja. Abragabhasma. Why Abragabhasma is having, I have told repeatedly the Abragabhasma. Why? Because the properties of Abragabhasma is very useful. Gauri Teja Paramam Amrudam Vadapitta Kshetnam. So in a degenerative condition as well as a Rukshavastha, Vadigavastha, Vada Pittotaravastha, you can use this Rasayana. Vadapitta Kshetnam Prajna Bodhim Prasamidarum Vrishyam Ayushyamati. So Prajna Bodhim. So it can also stimulate your brain cells. So the commands will be in normal. You can normalize the commands. The pranavada anulomana, we can say in our language as pranavada anulomana is essential in treating these respiratory pathologies. And you can even use Aridala. Aridala is very good. In many of the Kabhaja, Kabhadikya, and the Kabhavadikavastha, you can use Aridala Bhasma. And even Dasamanikya will do in some of the cases. Pravala Bhasma, we have already discussed about Pravala Bhasma. It has also the capacity to correct the even the structural damage of the lungs in bronchial the inflammations in the bronchioles and all. The best remedy is Pravala Bhasma. And the Kanda Pashana Bhasma is very good. The oxygenation in the system will be improved much. And the guidelines for using Rasausadhis, how you fix the dose, that's very important. How you put the dose, Sagandha, Nirgandha. So there is a guideline. How long you can use a Rasausadhi? How long you can use? This is the guideline. If the Rasausadhi is having the Parada as a content and Gandhaka is along with that, you can use it safe. Sagandha Murchida Sudo Chirakalam Parishilida. So if there is a Gandhaga along with Parada, it is very safe to use. So you can use. So in my experience, I have used it for long, many of the Sagandha Murchida. But for treating the disease, it may not require that much long. We will get results within 2 or 3 weeks or even 1 month. We are able to stop. But for Rasayana purpose, you can use it more. But if there is no Gandhaga, like a Rasa Pushpa, Rasa Karpura, you should be very aware. You should be very cautious. Gata Samshaya Kaladaha. You have to restrict the use. Only 2 or 3 times, 7 times, not more than that. You have to stop that. So this is the guideline. How long you can use. We can follow this guideline. Sagandha Murchida Sudo, it is safe. And Nirgandha Murchida, it is not safe. So Sagandha Sagni is more safe. So if you are subjecting it to Agni, then the Rasausadhi become more safe. You can think about Drasa, Sindura, Siddham Magardaja. It is Sagandha as well as Sagni. So they are very safe to use. So dose is another important area which you need to have a control. Actually, dose decides everything. A perfect dose for your patient, if you are able to fix that, that makes you a wonderful practitioner. So the same medicine will have different impact in different dose. So select the apt dose for your patient. That makes you a wonderful practitioner. So those for children, it is a very sensitive area. So up to 1 year age, you have to use only below 10 milligram for a child. This line I have adopted from the context of the dose of Rasasindura in Dasadarangani. So we can adopt it for almost all Rasausadhis. For up to 1 year, you have to give, if you are giving an adult dose, 100 milligram to an adult, the Abraga Basma, you only give 10 milligram to a child up to 1 year. Up to 2 year, you can give 20 milligram. Below 20 milligram, not more than 20 milligram, you should not give. And up to 6 year, you shall give 40 milligram, not more than that. And by after 12 year, you can use 50 milligram to even 135 milligram. This is a safe dose. And even antidotes are told in our Shastra. So the antidotes, Haridalam, Kushmanda Swarasa, Manashila, Kanmada, all are antidotes. All having antidotes. So these are not for poisoning cases. These are meant for hypersensitivity. Even if these are processed, some may get some hypersensitivity. In that context, you have to use these antidotes. Specific antidotes are told for each Rasausadhi. It is enlisted here for Aridalam, Satsivam, Jiragam, Chaudra. So if you give it the hypersensitivity, even though it is processed well, even though the medicine is processed, some may have some hypersensitivity. It will be solved. This will be the these the remnants of this will be expelled out from our system by using these antidotes, and the patient will get relief. Actually, I have got one or two experience with this. One patient complained of the whole body itching after the use of a drug having containing aridala. So I have given this Kushmanda Swarasa for continuously for 3 days, 30 ml 3 days, and Durva Swarasa 60 ml. Durva is also a very good antidote. And three, urgently we need to stop the medicine and we can apply the antidote. And you can see after 3 days the itching and all stopped, became normal. So this may happen at times, very rarely, due to the hypersensitivity, not due to toxicity. It is not toxic if the drug is properly processed, as well as you are able to use it in a proper dose along with dietary restriction, then there will be no toxicity associated. So you have to check the genuineness of the medicine. So one time I have an experience of using Abraga Basma. From a shop, I saw Abraga Basma having glitter. So it's not, it will spoil your patient. Don't use it. So you have to test randomly. From any source, if you are collecting, you have to test it randomly. The Basma Parisha you can do. But just taking one pinch of Abraga Basma and you paste it in your hand, rub it in your hand, and show it in the sunshine. If there is a luster in it, you avoid it. It will cause problem. So it should be Nischandratvam. So there should not be any shining to Abragavasma. If your Abragavasma is having shine, you don't use it. You should not use it. So make sure that your drug is properly prepared, it is genuine, and you are using in right dose and in proper diet restriction. So these are some of the antidotes. And I'm coming to the conclusion that the logical selection of the medicine through apt judgment, the Vadik, the whether it is Vadika, whether it is Paitika, the doshic predominance, about the status of the dhadus, about the bela of the patient, about the agni of the patient, all those you should consider through your judgment. You have to set a logical aushadhi. Then only it will work. And if you select it, it will work wonderfully, much more than any modern medicine. It will work wonderfully. So the dose determination is very important, and the selection of right anupana or sahapana very much important in curing the disease. And If you do like this, you have a sustainable management of health by this Ayurveda. Thank you all. Thank you for the patient listening.
Thank you, sir. Thank you, sir. It was really a brainstorming section, sir. You have
Thank
included the most crucial disease, that is the COVID-19, what all medicines we can give in such a conditions, because we know each and every day, we know what all new diseases are emerging in our country, and we should be occupied with all the medicines. And without any doubt, sir, I can say that this section made us all with all the potential of Ayurvedic principles to treat any such respiratory condition, sir. And you have very well explained about the dose of the Rasausadhis also, because it's a concern. It's usually a concern. What should be the dose of the Rasausadhis? And you have very well explained it by clearly explaining the difference between the Sagandha Rasausadhis as well as the Nirgandha Rasausadhis, and the importance of yukti and samskaras in the samskara means the processing of the medicines as well. So it was really a wonderful section, sir. Now,
thank you,
let me
Anjali.
start the question answer section, sir. So, first, I will start with the section, sir. First of all, there is always a concern regarding the toxicity of the Rasaushadis. It has been a talk among all the Ayurvedic physicians as well as the modern doctors, sir. So, how to address it, sir? Or what all are the trusted pharmacies from where these physicians can purchase the medicine, sir?
Yeah, that's a very important question which you have asked. Uh, Actually, two or three important aspects you should consider regarding the toxicity. Actually, we are using these Rasausadhis are toxins. Actually, we are using toxins, but we are using it wisely. We are converting the toxin to excellent medicine by virtue of the processing. So, the Manashila or Aridala, it is arsenic. When you use it in a raw form, it will cause damage. But we have techniques to convert in, use it as a excellent designers. Instead of doing harm, it's giving us immense effect, excellent effect in our health. So we are tuning that by different process. So the thing is that you should be able to confirm the source of medicine is very good. That's why I have asked you, in order to ensure whatever be the pharmacy you are purchasing, you can select a pharmacy which is actually having a credentials for long years they are making with a good credit with a very good credentials in them. You can select. Most probably, I have used many of the medicines of from North India. I have used Sri Dudh Pabeshwar, that Uma Pharmacy. All these are usually preparing in a good way. And from the south, Improps of Adayar in Kerala, Siddheshwara, and all these are preparing genuine medicine. But even if you are selecting from a good pharmacy, you need to check in a random way while giving to your patient. You have to verify yourself. For example, I have told about the Abdraga, whether it is having Nischandratva. You can test, very simple test, and you should ensure it well. So these toxicity arise because whether it is not properly prepared, it will arise the problem of toxicity. That's one problem. Second, if the dose, you have to use it in correct dose. If the dose is high, it is not safe. If it is a rasayana, if I am using 100 milligram of abraga basma, in that dose it is safe. So up to in our Shastra, it is told that it can be used up to 2 rati or 3 rati maximum. So 375 milligram maximum dose. But usually in my experience, I am using it in one third of that maximum dose. Only 100 milligram I am using. So in that dose, I am feeling comfortable with the effect and I am getting the results. So the dose you have to be very careful while using the Rasausadhi. And the third one is the duration of use. So that's why I have told about the two guidelines in that. You have to stick on to that. Because if it is processed with sulfur, if the mercury is there in your formulation, and you should verify whether the Gandhaka is there. The Gandhaka is there, it is more safe. And even if it is processed in Agni, like a Kubibaka or Rasayana, like a Rasindura or Siddhamartha, it is safe. So you can also even use, I have skipped one or two things, the Potali Kalpana is also there. And in Kasa, you can use some potalies of Aridala, Tala Garbha potali, and Abragab potali you can use. And even Manashila, Shila Garbha potali you can use. Pravala Garbha potali you can use. It is having some more potency if you convert into potali. But in that case also, the dose is very important. The processing is very important. And you have to restrict according to the period. So, but one time you can see that the Arogyavardhini in the Arogyavardhini Rasa, Mandalam Sevidamsa Esham. So one mandala, but it's a wrong interpretation. It's one mandala. I guess for one mandala it should be used at least for one mandala for curing the kushta, and not you shall not restrict it by one mandala. You can go further. It is very safe to use. But there is a formulation called Rasagandhi Medugu. Even it is in Siddha. In Kerala, many of the practitioners are using. In Siddha, they are using Rasagandhi Medugu. But it is not safe to use after 41 days. It is not Agni Paga. It is prepared by pounding, not Agni Paga. No Agni Paga is there. So it is not that much safe. So you have to restrict its use by 41 days. And many practitioners are using it without this knowledge for long time, and it may cause some negative effect on the health. So this is we should use it in a very careful mode. You have to restrict it when it is said like that. In that formulation, it is said mandala. It can be used only for mandala. So 41 days, you have to you have to restrict it use. And you can use it again after a period of break of say 3 weeks. For 21 days, you have to stop and then you can restart if needed. So it is very useful in many of the tumors and many of the non-healing ulcers. So you can use it, but use with the restriction. So type, this kind of knowledge you have to be in practice, and you will be very careful. And if you are very careful with this, you will not end up in any toxicity. Any toxicity. You may be hearing some of the cases of toxicity in some of the journals they are reporting, but maybe it is due to the long period of use. They are using for 1 year. Some Nagabhasma they are using for 1 year. So it may cause problem. So that long term use is not enough, not needed. You have to restrict its use according to the condition of the patient, according to the ingredient of that yoga. You have to restrict. You have to decide. That's very important for its safe use. When you use it this way, the results are very encouraging and no toxicity will be associated. It's very definite. Thank you.
Thank you, sir. Now I request all the participants, if there is any query, kindly post those queries in the chat box. Now, sir, Dr. Praveen has raised a question. That is, kindly mention the ingredients used in Manashilati Dhupan along with its quantity.
Yeah, a very good question. That I have modified a formulation which is in Sahasra Yoga Kasa Prakarana, Kasa, and in that the ingredients are Manashila. One ingredient is Manashila. Second ingredient is Haridra. Haridra. Third ingredient is Trigadu. Trigadu. And you are grinding it with the Bringaraja Sarasa. So Manashila, Haridra and Trigadu, in which I have used only 1 by 4th portion of Manashila. I have used 1 by 4th of the ingredient, all one part each, but Manashila 1 by 4. And it is being grinded in uh, Bringaraja Swarasa and made the Varti with that. That's the formulation. That was the formulation.
Okay, sir. Now, Dr. Gurpreet Singh has raised that can we use Gridha preparations also in Kasa, particularly in Paitiga Kasa?
Yeah, you can use, but you have to you have to use carefully. In Paitiga Kasa, you can use it, but the dose should be very much restricted. And also the inflammatory stage you need to you have to avoid in the inflammatory stage. Even it is a Paitiga Kasa, there may be an association of Samavastha first. So in this Samavastha, it is better to avoid Grida. So for that, we have to follow the guideline from Jwara Chikitsa. So that is in Kabha Kshina and Vada Paitiga. So if it is a Vada Paitiga without any uh, association of Amanubandha, you can definitely use Grida. But the dose of Grida you need to restrict. Only in drops you can use first. And if the patient is improving, you can increase the dose. Okay.
Okay, sir. Dr. Neetu has asked to explain the treatment approach of allergic bronchitis and allergic rhinitis.
Yeah, that is an excellent question. So you have to follow Pradishaya Chikitsa here. Pradishaya is the specific treatment which we need to follow in this allergic rhinitis and the all the allergic bronchitis. So you can have 3 or 4 options. The Shamana Chikitsa you can do with one thing is Pravala Basma and another one is with this Siddha Magardaja. Pravala Basma and Siddha Magardaja you can combine and use in this type of allergic manifestation. Along with that, you should use one Anupana like Padyaksha Dhatrayadi Kashaya. Padyaksha Dhatrayadi Kashaya. And if it is bronchitis, you can switch over to Bharngi Kanadi Kashaya. So you can select this what you call Pravala Basma and the Siddha Magardaja, and you have to use it since this is a allergic response. This you have to change the pattern of the physiology. For you have to use it for 1 or 2 months. Then the frequency will be less, and the patient will get relief, and the recurrence will be less, frequency will be less. Normally, he comes to his normal physiology. So for Pradishaya Chikitsa, you can apply to both. And in allergic rhinitis, the best thing is to have Shwasananda and Kanagasava as a combination of Kanagasava. You can grind 20 Shwasananda Guliga to 1 bottle of, that is 450 ml of Kanagasava. Grind it well and mix it with that. And 2 teaspoons, 10 ml thrice daily. Along with that, you can use this Pravala Basma and Siddha Magardaja at night, bedtime. And along with that, you can use the Padyaksha Datriyadi Kashayas Sahabana. But for bronchitis, you have to change the Sahabana to Arni Ganadi Kashaya.
Okay, sir. Now, Dr. Bimal has asked to explain the difference between Pravala Pishti and Basma. What all
Yeah, yeah.
conditions we can apply that?
Yeah. That is very important. This by virtue of the Aushadha Samskarana, even if the drug is the same, we can modulate its use in different ways. Since the Pravala Pishti is more by virtue of the processing, it is Shidala. So you can use it in different conditions like perimenopausal syndrome. It's very useful in that perimenopausal syndrome. So in that you can see a uh, pitta vriddhi as well as you can see a pitta vriddhi as well as hot flushes in the body. Hot flushes. In those cases, this Pravala Pishti is excellent. Along with Guduchadi Kashaya you can use. And maybe those patient may have some uh, problem with the mind. Their mind may be affected. So you can also support them with Manasa Mitra Vada. It will be very good in those patients. So in those cases where the hot flushes are there, the hormonal disturbances are there, you can use Pravala Pishti. And one thing I have already explained about Pravala Pishti is that in Amla Pitta, it is connected, if the respiratory disease is connected to the digestive system due to the gastric irritation, due to like GERD, like those, in those cases also, the Pravala Pishti is much more better than Pravala Basma. Thank
Okay, okay, sir. It's clear now, sir. Now, Dr. Finsha has asked to explain the cautions and contraindications while giving Samira Panagarasa.
Yeah. Samira Panagarasa, actually it is a Kubi Pakarasana, but it has very Tishna ingredients like Manashila, Ridala and all. So the dose should be very careful. You can use a dose of 50 milligram. Even 1 dati can be used at times, but 50 milligram is a safe dose. And you have to be careful with the ahara. You have to advise the patient some diet restrictions to ahara like spicy, ushna and tishna vida foods should be avoided. And you can even withdraw the medicine. 1 mandala is enough. By 1 or 2 weeks, by 2 weeks itself, by 14 days itself, you can also withdraw the dose or minimize the dose. But it can be used further if needed, no problem.
Okay, sir. Pragati has asked us what all are the antidotes which can be given for the itching caused by the Haratal use.
Yeah. The one thing is that one patient I have reported about a complication. Complication, most probably a hypersensitivity of that person. Even Haridra, which is good for allergy, is hypersensitive to some person. So we can expect it. So in those cases, I have administered Kushmanda Swarasa, 30 ml. For 1 or 2 weeks, you can continue its use. Early morning in empty stomach, you can use it. And Durva Swarasa internally. And the best thing to arrest that itching is with the use of Spadika Basma. Just like a powder you have to rub in that area. You can see the hypersensitivity, itching due to the hypersensitivity will reduce.
Okay, sir. It's very clear, sir. And Dr. Shinsha has asked, share your experience of the use of Rasausadhis in industrial lung disease.
I didn't have an exposure to that patient. We can try according to the condition, but actually I didn't treat that patient. That's why I'm not answering. But we can do that by examining him. What are the problem with that? The industrial affluent. Actually, what are the industrial affluent which he or she is exposed? You need to check, and it is also important for chelating that. So you can do a Shodhana therapy. After Shodhana, you can use Rasayanas. The Rasausadhis we can select according to the industrial uh, exposure. According to that, we can select. And considering his Balavastha, the Sharira Bala, and the complaints which she or he is presenting. So you have to check the what are the complaints he has. According to that, we can decide.
Okay, sir. Another question from Om Prakash, where there is a patient, a female patient of 15-year-old having Tundikeri Shodham for the past 3 to 4 years, along with Kasa and red swollen tonsillitis, having Apatya Palan like cold water intake. So, how to plan the treatment, whether to start with the Dupana or Rasaushadis? I think we have
No,
already discussed it, sir.
yeah, the Dubana is not sufficient here. But you can address the problem with the use of those gargles and throat pains, which we have already discussed. Along with the Pravala, you can use Pravala also, and the Rasasindura. Padyakshadatryadi Kasha is a very good Sahapana. And also Padya Kustumbaryadi Kasha in Jwara Chikitsa. It's also very useful in this. And Padhyadi Kashaya is very good for Anulomana. And you have to avoid the dietary restriction. You should advise to avoid all the refrigerated drinks, curd, etc. That's very important along with the treatment. The dietary restrictions are very important that you have to advise along with the treatment. Okay.
Okay, sir. Now, a question has raised by a UG student. Why some drugs why some drugs causes side effects like continuous usage of hartal causing itching all over the body? Because it has got so many gunas, still why it is causing such kind of harm effects over the body?
Yeah, that's a very good question. I like that. The thing is that this is useful in many conditions because it has some potent elements in it. So that potent elements may have some harmful effect also. That is the thing. So if we are able to tune that, we can use it for very good use. But if you are not timing it well, it will be dangerous. So I can get an example. So snake poison. Snake poison, if a snake is biting, what happens? It suddenly gets into the brain. And it's a wonderful medicine, isn't it? It it reaches the brain within a fraction of a second. But what is the wrong in it? What is the problem in it? It is lethal. It can cause even death. So you have to tune it. You have to modulate it. Otherwise, uh, it will create impact, whether bad or good. It will create huge impact. So, in order to make it safe, we have to tune it. That's Rasashastra. That's the technology of Rasashastra.
Okay, sir. Avantika has raised another question, sir. Then how to know whether our body is compatible for that particular drug?
Yeah. Usually, if we process the drug well and give in the ratio according to the age and Vyadhyavastha and Sharira Bala and Agni Bala, you will not get any complication. But for Rasayana purpose, you need a Kshatrigarana in order to make the body incapacitate you to utilize this medicine. So for that Kshatrigarana is told in Rasashastra, which is equivalent to the Pancha Karmas. And the Pancha Karmas of the Shastra is Snehanam, Swedanam, Pajanam, Snehanam, Pajanam, Snehanam, Swedo, Vamanam, Rejanam, Tadha, Edani, Panchakarmani. So these processes makes our body capable to tolerate this medicine, but it is not needed in every case. It is needed only for rasayana purpose in order to make these drugs enter into our body and incapacitate its role. But usually, if you are giving the dose in a prescribed dose to a patient, it will be suitable. It is designed like that. For that, this Shodhana, Marana, and all the processes are instructed. And the dose is also very well instructed.
Okay, sir. By this, we have come to an end of this question answer section, sir. Many questions were there. It shows our participants were really got interested in this section, sir.
Yeah, thank you for giving me the opportunity. And Dr. Anjita is one of my PG students here at Trivandrum. And I thank you also for inviting me over there and all the faculties and dignitaries there and to the students. And you have heard this with great interest. That's why so much of question. And I'm very happy with you. Thank you all.
Okay, now let me invite Dr. Banani Das, the professor and HOD of the Department of Rasasastra, to deliver a vote of thanks. Ma'am, please.
Thank you, Dr. Anjita. It is an honor to me the opportunity to express my appreciation to all the dignitaries present today in the webinar. I am grateful to the esteemed delegates of the webinar for their presence and efforts to make this event a great success. I extend my sincere thanks to our Honorable Chairman, Sir, Dr. Shailendra Jadhav, and Chairperson, Madam, Dr. Shunita Jadhav, Ma'am, who gave motivation to us always. I pay my special thanks to our chief guest, Dr. Anand, Sir, for taking time from his busy schedule to be with us. Your each word is very valuable and practical. It must be very helpful for our students and delegates for clinical practice. Special thanks gives to our principal, Sir, Dr. S.K. Vishwal, and Vice Principal, Sir, Dr. Tentu Rambabu, Sir, for their unwavering support for making this webinar successful. My heartily gratitude also goes to Dr. Prithimoy Sahu, Associate Professor, Chikiৎসা Department, and beloved colleagues, Dr. Anjita, Assistant Professor, Department of Rasasastra and Bhaisajya Kalpana for their efforts to a successful webinar. I also acknowledge to organizing team, especially Dr. Nihar Ranjan, Associate Professor, Department of Panchakarma, and Dr. Srinath B.S., Assistant Professor, Department of Panchakarma, for their hard work in the lead up to this webinar. I extend my congratulations to all the participants for their active involvement. Thank you once again to everyone for making this event a grand success. Thank you. Thank you all.
Thank you.
Thank you, madam. Now, to end this section, I invite Dr. Preeti, madam. Madam, please.
Oh, thank you so much, ma'am. Anand and Dr. Anjita, and thank you so much to our guest speaker of today's session, Dr. Anand. Sir, very beautifully you described all the things, and I think all our students will be having a very clear idea about use of the Rasasastra and any kind of medicines, antidotes, and everything. So thank you so much, sir, and very, very thanks to all our delegates who have attended to today's webinar and actively participated with their questions and varieties. So many varieties of questions we got today. So thank you so much. With this, we will end this session, and before ending, let us with our national anthem. So please be prepared for our national anthem. And we all will be sharing the video links in the group. So please be there in the WhatsApp group. And of course, all the participants who have attended the webinar more than 45 minutes and registered with the proper email ID and names will be receiving their e-certificates within 7 working days. So be patient and be with us for the next webinar also. We will share the details of next webinar in the same WhatsApp group. So with this, we end this session. Thank you so much and namaskaram to all.